Hi, I'm David Ward.
The SARS-CoV-2 virus emerged in 2019 and resulted in an estimated 767 million individuals worldwide with the virus-associated disease, COVID-19. Most individuals appear to recover from acute COVID-19 illness within 4 weeks. However, some continue to have ongoing symptoms. Others can experience newer recurrent symptoms and conditions after this acute phase. The tremendous number of people suffering from long-term adverse symptoms triggered by this disease is COVID's real legacy, long COVID. So long COVID, sometimes referred to as post-acute COVID, chronic COVID, post-COVID conditions, long haulers, and post-COVID syndrome, is a multi-system condition comprising often severe symptoms that follow SARS-CoV-2 infection. The Centers for Disease Control defines post-COVID conditions as an umbrella term for the wide range of health consequences that can be present 4 or more weeks after infection. According to the World Health Organization, post-COVID condition is defined as a continuation or development of new symptoms 3 months after the initial SARS-CoV-2 infection, with these symptoms lasting at least 2 months. So after more than 3 years, there is still no agreed upon definition for long COVID, which creates confusion among both clinicians and patients. There are no proven drug treatments and no standards of care, which means there are no guidelines and no trained workforce. This leaves patients undiagnosed and providers ill-prepared to recognize, evaluate, and treat long COVID in their patients. Providers and patients are frustrated, with patients left to question where to turn for guidance and help. Now, most long COVID cases result from mild acute illness, and 1/3 of people with long COVID have no identified pre-existing conditions. As of May 9th, 2023, the CDC announced they will no longer track cases, and according to their COVID data tracker from May 1st, reported U.S. cases total more than 104 million. However, it's estimated that 60% of the U.S. population have had COVID, so it's estimated to be more like 200 million reported plus unreported cases. Now, 15 to 30%, or approximately 15 to 30 million people living in the U.S., have persistent long COVID symptoms at 1 month after initial infection, which is the CDC definition. 6 to 10%, or approximately 6 to 10 million people, have persistent symptoms at 3 months, which is the WHO definition. And 1 to 2%, or approximately 1 to 2 million people, have persistent post-COVID symptoms at 12 months post-infection. So if you're one of the countless individuals suffering with long COVID, you are not alone. Now, in the conventional medical approach, patients are evaluated and referred to cardiologists, neurologists, pulmonologists, rheumatologists, and other specialists, where treatments are similar to what they would be for non-COVID patients with similar symptoms. However, there's a growing understanding that people experience the condition in different ways, leading to a recognition that there is a need for individualized approaches to treating both symptoms and the drivers of long COVID. Now, in 2020, Congress made an investment of $1.2 billion to learn more about long COVID. As the largest government-funded study on this topic, the National Institutes of Health initiative called RECOVER, which stands for Researching COVID to Enhance Recovery, is intended to set precedents for future research and clinical guidelines. But the NIH hasn't started testing a single treatment. In fact, the NIH has spent the majority of its funding, over $800 million so far, primarily for long COVID research on observational studies of patient symptoms. Now, the NIH is planning 5 clinical trials. each of which will test treatments that may help with a major category of long COVID symptoms. Some of these treatments will be drugs, while others will be behavioral therapies, such as cognitive retraining, as well as exercise and rehabilitation. However, the RECOVER initiative hasn't enrolled a single patient in any of those proposed clinical trials, and there is no estimate for when trials might start. Now, a recent study published in the Journal of the American Medical Association, which represents the first analysis of data from the RECOVER initiative, identified 12 hallmark symptoms of long COVID, including post-exertional malaise, and that can be physical or mental exertion, fatigue, brain fog, dizziness, gastrointestinal symptoms, palpitations, changes in sexual desire or capacity, loss of or change in smell or taste, thirst, chronic cough, chest pain, and abnormal movements. However, more than 200 symptoms have been identified with impacts on multiple organ systems, as demonstrated by this graphic from the NIH COVID-19 research webpage. Now, conventional treatments offered to people with long COVID are designed to reduce symptoms, but do not seek to identify and address the underlying or root causes. We need an approach that understands the origins, prevention, and treatment of complex chronic disease. An approach that shifts the traditional disease-centered focus of medical practice to a more patient-centered approach and addresses the whole person, not just an isolated set of symptoms. We need a functional healthcare approach that's been shown to be effective when used in other conditions that do not have clear and specific curative options, such as ME/CFS, previously known as chronic fatigue syndrome, fibromyalgia, chronic pain, and post-treatment Lyme disease syndrome. So the question becomes, what do we know now, and what can we do with what we know now to support an individual's healing process? Now, in order to develop effective treatments that target the root cause of long COVID, first we need to understand the mechanisms of how the SARS-CoV-2 virus causes acute illness, as well as how the acute response can become a chronic condition. We know that for a virus to cause sickness in a human being, it must enter the body, then attach to and enter a host cell, then create new viral copies. The virus that causes COVID-19, SARS-CoV-2, usually enters the body through the nose or mouth, but can also enter through the eyes by direct contact. The spike protein on the surface of the virus binds to cells that have a particular type of receptor on their surface, the angiotensin converting enzyme 2, or ACE2 receptor. Like a key unlocking and opening a door, this connection allows the virus to enter the host cell. Inside the cell, the virus releases its ribonucleic acid, RNA, which is a molecule that contains the genetic instructions that direct the cell to create the proteins necessary to make more virus. The viral RNA is translated into a long protein chain. Then viral enzymes break the protein chain into smaller protein units, which become the building blocks of new viral copies. Then the new virus is released and can then infect more cells. So the SARS-CoV-2 virus gains entry into the cells of multiple organs via the ACE2 receptors. And we know that nearly every tissue in the human body has ACE2 receptors and can allow for viral penetration and tissue damage to occur, ultimately leading to numerous persistent symptoms, some of which are shown here. When we look at the subset of patients who sustain an acute SARS-CoV-2 infection and go on to develop a wide range of persistent symptoms that do not resolve, we see that there seems to be a series of clinical subtypes that are going on. Some people will have multi-system, multi-symptom illness from ACE2-associated tissue damage. Some have clotting and vascular issues. Some have imbalances in brain and vagus nerve function. Some have viral persistence or reactivation of other pathogens, such as herpes simplex viruses, HHV6, and Epstein-Barr virus, which are collectively referred to as neurotrophic pathogens. Some will have dysregulation of their microbiome, and some may have activation of immune cells that results in excessive inflammation and the development of autoantibodies. And when we look at what's behind those subtypes, we see that there's 5 primary mechanisms or drivers highlighted here in light blue. There's ACE2-mediated tissue damage, viral persistence, whether that's viral fragments or whole virus, and chronic inflammation. And as we look at the aspects of chronic inflammation, we see that it's related to alterations in the gut microbiome and the mitochondria. So there's an interaction between these components of the inflammatory process within the immune system, the microbiome, and the mitochondria. So we see that it breaks down into these 2 areas. There's ACE2-mediated tissue damage, and then there's alterations in the immune system. And we see that ACE2-mediated tissue damage can affect the immune system, can affect chronic inflammation, and chronic inflammation, especially with viral persistence, can lead to ongoing tissue damage. So we have to look at all of these components as we look at the progression from acute COVID to long COVID. In the acute COVID phase, what we see is there's some tissue damage, for example, in the lung, heart, endothelium, which is the inner lining of blood vessels, and along the mucus lining in the kidneys and GI tract. Although since there are ACE2 receptors nearly everywhere in the body, almost any organ can be affected. And we can also see it progressing into brain inflammation that can lead to mood disorders, cognitive dysfunction, and brain fog. We also see clotting disorders and vagus nerve dysfunction. Now, as we go from that acute COVID phase to long COVID, we've now moved from acute inflammation to a chronic inflammatory phase. We could see indication of persistent viral fragments, Epstein-Barr virus reactivation, as well as reactivation of other neurotrophic pathogens, such as herpes viruses, and chronic inflammatory dysfunctions that relate to microbiome dysbiosis and mitochondrial dysfunction. We also see immune system impacts with activation of microglia, which are responsible for producing brain inflammation, as well as T cell dysfunction and mast cell activation in some individuals. Now, for more information about T cells, check out our video, What Your Doctor May Not Tell You About Autoimmune Disease. And information about mast cells is contained in our video, Why Am I Still Sick? The Role of Incomplete Healing in Chronic Illness. Both videos are available on our Entavita YouTube channel. So we come back to these 5 mechanisms, looking at ongoing tissue damage and injury, viral persistence and/or reactivation of pathogens, chronic inflammation, microbiome dysbiosis, and mitochondrial dysfunction. Now, these are some of the things we're used to looking at with a functional healthcare approach. When we look at the whole person and see how all of these things fit together, because we know there's an overlap and interrelationship of all of them. We can't just take one component and say, for example, we're going to fix the mitochondria and the individual is going to get better. It just doesn't work that way. And we see that injury will lead to immune dysfunction, And there's a loop process where more injury leads to more immune dysfunction, and more immune dysfunction leads to more injury. So, how do we support recovery and restoration of health after COVID-19? Well, in a functional healthcare approach, we start by looking at the individual. And rather than focus exclusively on symptoms, we're looking at the terrain. We want to understand who that individual is. What's their past medical history? What are their comorbidities? And then we have to look at the setting. What's the context of what's going on with the individual? For example, how severe was their illness? We know that people who had more severe SARS-CoV-2 are more likely to get long COVID. However, we find that currently about 2/3 of the patients, of those up to 2 million individuals who have long COVID symptoms a year after initial infection, actually only had mild cases. So while it's worse in individuals who had a worse illness, it's still very common because many more people had a mild infection. Now, because there is no test or lab marker that's diagnostic for long COVID, we use lab testing to look at an individual's metabolic profile in order to get a determination of whether there's something else going on that may be contributing to symptoms. For example, anemia, thyroid dysfunction, or nutrient deficiencies. We also use advanced functional testing to identify other contributors to chronic inflammation, such as toxins, infections, gut dysfunction, or microbiome imbalances, for example, in the mouth. And the primary thing we're focusing on in our approach is looking at an individual's overall function. In functional healthcare, we talk about functional status and functional outcomes. So we look at patient-reported outcomes measures that can be used to track improvement in function over time. This exploration into understanding an individual's unique situation also informs the development of a personalized, lifestyle-based approach, first by making sure the individual has appropriate supportive lifestyle factors in play. So first, food and nutrition. We recommend a diversely colorful, nutrient-dense, plant-based, anti-inflammatory dietary approach with high-quality proteins and fats. When you look at the research on plant-based nutrition, it's associated with greater recovery from both acute and long COVID. And the physiology of a plant-based diet benefits are very well matched with the drivers of long COVID. Then movement and exercise. Now, movement is a pillar of healing from long COVID. We know that moderate, regular activity is essential to optimal functioning of the immune system, circulation, and tissue oxygenation. Any movement is better than no movement. However, pacing of movement is essential because movement in the way an individual used to move is frequently not an option because of the risk of post-exertional malaise. And as with plant-based nutrition, the physiology of the benefits of exercise is very well matched with the symptoms of long COVID. Next, sleep optimization. The shift in circadian rhythm, the 24-hour cycles that are part of the body's internal clock, combined with the inflammation associated with the SARS-CoV-2 virus, causes blood-brain barrier leakage. And that can create a cycle of more sleep disruption, more circadian rhythm disruption, and more of the neurological symptoms seen in long COVID. It's actually termed coronasomnia. So supporting sleep, especially deep restoration time, is essential. And both quality and quantity matter. Also, stress modification. So stress is clearly an exacerbator of long COVID symptoms. Long COVID is associated with altered cortisol levels and low activation of the hypothalamic pituitary adrenal, or HPA axis, that governs the stress response. And worsened by stress, mental health impacts post-viral recovery. So stress response modification is foundational. And nutritional supplementation. We recommend a curated suite of nutritional product solutions to provide support for the 5 main drivers of long COVID, in addition to foundational nutraceuticals selected to support optimal health and well-being. Lastly, social connection. Now, people impacted by long COVID reflect about how isolated they continue to feel as others move on with the lifting of the pandemic restrictions. Connecting individuals experiencing long COVID to community, and especially to supportive people experiencing similar losses, is essential to recovery. At Entavita, we provide this social connection through our group visits programs. Now, evidence supporting a lifestyle-based approach for long COVID comes from the results of this recent study of 2,000 women published in the Journal of the American Medical Association that showed adherence to a healthy lifestyle prior to SARS-CoV-2 infection was inversely associated with risk of post-COVID conditions in a dose-dependent manner, meaning the more healthy lifestyle factors an individual had before contracting SARS-CoV-2, the lower the risk for long COVID, compared with those who did not have any healthy lifestyle factors. Those with 5 or 6 had half the risk of long COVID. So lifestyle clearly has a direct impact on COVID recovery. Now, we've shown that functional healthcare is a healing-oriented approach that takes account of the whole person, including all aspects of lifestyle. And in this approach, which emphasizes the therapeutic relationship between practitioner and the individual, is informed by evidence and makes use of all appropriate therapies. We've seen that even when diseases such as long COVID do not have clear treatment guidelines, practitioners can use functional healthcare principles to facilitate recovery. In addition, a lifestyle-based approach can empower the individual to aid in their recovery. We've shown that an extensive review of the literature identifies 5 primary drivers of long COVID, and we've shown that disruptions of lifestyle-related factors are part of the clinical picture of long COVID. So if you want to get clear on the exact steps you should be following right now to uncover and address the root causes of your ongoing long COVID symptoms, then request a discovery consultation at the link below this video. In just 30 minutes, you'll understand if Entavita's approach is right for you. Please note, this discovery consultation is only for you if you're actively looking for someone to help you address chronic ill health, are open to explore beyond what you've already tried, are willing to make sensible changes, and are ready to invest time and money into your health now. If that's you, then click the link below to request your discovery consultation. We look forward to connecting with you soon.